Welcome to Safe Money Talk with Rick Liuag. Rick is a safe money specialist, primarily serving Southern California, but he's sought after nationally for his expertise in helping people secure their retirements. Mr. Liuag is a licensed insurance professional in the state of California and specializes in working with business owners, people who are near retirement, or those who have already retired with wealth management, income planning, and asset protection strategies. And now, here to talk to you about safe money and retirement, your host, Rick Liuag.
Hello again and welcome to Safe Money Talk. I am your host, Rick Liuag. We're coming out live from the studios at KCAA, 10:50 a.m. here in San Bernardino. If you'd like to call in and ask any questions or make any comments, if you're inside of the 909 area code, call 909-888-5222. And if you're outside of the 909 area code, call our toll-free number at 888-909-1050. We've got an awful lot to talk about tonight. Like usual, this is the show where you are going to get the straight talk about what the threats are to your retirement savings and your business if you're a business owner. This is where you're going to hear all of the threats to your money that you're probably not going to hear from your CPA, your tax attorney, your certified financial planner, and especially not your broker or your group health insurance agent. What I want to start with this evening is something that I've been warning everybody about for 2 years. And I've been called Chicken Little. I've been called the guy crying wolf. But I will tell you, now that folks are seeing this happen, I'm being called Paul Revere. And I'm going to read this article. It's a pretty long article, but it's going to make my point. And this is what we've been talking about now for 2 years that was going to happen. Nobody believed it, but if this doesn't scare the living daylights out of you, then nothing will, especially if you're close to or at retirement age. This is an article that was written December the 5th in the Houston Chronicle. And the headline is, "Insurer Cutbacks Squeeze Patients Out of High-End Care. Thousands are left furious, terrified after PPO plans are dropped." Now, we've been talking about this and warning folks about this for a long time. The article starts with more than 88,000 people in the Houston area have lost plans from Blue Cross and Blue Shield of Texas for 2016. Now, you have to remember Texas, especially that part of Texas, has some of the best medical facilities in the country. MD Anderson is down there. That is kind of like Los Angeles with Cedars-Sinai and UCLA Medical Center. Now, Blue Cross and Blue Shield canceled some of their plans this summer, 2016, potentially cutting off some of the most seriously ill from the top-tier medical care the city has built its reputation on. Houston, is, like I said, is famous for their medical facilities. Last summer, the state's largest insurance carrier dropped all preferred provider organization plans, PPO plans that we know them as, from both the Affordable Care Act's federal exchange in Houston and the private individual market. Their PPO plans, Blue Cross, Blue Shield, the largest insurer, canceled all their PPO plans for 2016. Now, with only weeks to go before existing plans expire, patients, doctors, and hospitals are scrambling to find what care is available under the insurer's Replacement Health Maintenance Organization plans, or HMOs. So if you've been on one of these top-tier PPOs for the last couple of years, in 2016, you're kicked off. Those plans are no longer acceptable, and you have to choose an HMO, which are much more restrictive. Now, quote, "Jody would be dead if she didn't have her oncologist," says Steve Shoger of his wife, his voice catching. "The Woodlands couple had their plans canceled. Both have cancer. Both are in experimental clinic trials at the University of Texas MD Anderson Cancer Center, and they fear they cannot replicate that treatment anywhere else in the country." So they both have cancer. They're both being covered by these PPO plans. The doctors and hospitals that they need to use to stay alive accepted their PPO plans, but now they're finding that those doctors and hospitals that they've been using for the past couple of years are no longer going to be on their health insurance plan for 2016. Back to the article, it says they are at turns furious and terrified. I bet terrified was first before furious. Even if the former PPO plan holders shift to one of Blue Cross Blue Shield's HMO plans on the exchange, those with the most complex medical needs still could be forced out of certain types of specialty care and left to find similar life-saving treatments elsewhere. So in other words, these folks are really ill. They're used to their doctors and clinics that they've been treating them for the past couple of years. Now they're booted off. PPOs typically offer more latitude in choosing treatment. Back to the article. While less expensive, HMO networks are more restrictive. Those of you that have been on an HMO, you know exactly what they're talking about. First of all, you have to have a referral from your primary care physician to go to a specialist. A PPO, you don't need a referral. And PPO networks are usually larger than the HMO networks. MD Anderson, which is where these folks are going, MD Anderson, Texas Children's Hospital, Houston Methodist and Memorial Hermann, all at the Texas Medical Center, will be out of network in Blue Cross Blue Shield's HMO exchange offerings for 2016, according to the insurance company. Now hear this. This is quoted in the article. Those with employer-sponsored group plans are not affected. That's important because if you're in Texas and you're in Houston, Texas right now, and you're covered by Blue Cross Blue Shield, that PPO network and the group health insurance network is probably going to remain intact. However, here's something to consider for those of you listeners. I just had 5 business owners call me within the past 5 or 6 days telling me they were canceling their group health insurance plan because it was too expensive. And what they were going to do is give their employees an allowance to go out to the exchange. So if this happens to those employees in Houston, Texas, if their employers do what most employers are going to do over the next couple years, which is canceling the group health insurance plan because it's too darn expensive and giving the employees an allowance and saying, go to the exchange and get your plan, these folks will not be able to go to MD Anderson or some of the top tier hospitals and doctors in the Houston area. Expect that to happen here in Southern California next. It's already happening in Florida, and we warned you about this 2 years ago. Now, let's hear from the president of Blue Cross Blue Shield of Texas, Dr. Robert Morrow, president of Blue Cross and Blue Shield of Texas, Houston and Southeast Texas region, said in a recent interview that decision to drop 367,000 PPO plans across Texas, even though customers were paying more for them, was driven by economics. So there's 367,000 PPO members in Texas who were paying a lot more to have a PPO, but he called those plans, quote, unsustainable, after his company lost $400 million by paying out more in claims than it collected in premiums. This is all by design. All of this was predictable. Everybody was warned about this, and now it's coming to pass. Now the curtain's been pulled back. So these folks expected to be on their PPO plan for 2016. They've been paying even more than the exorbitant Obamacare rates. And now they're kicked off and they've got to go on an HMO because Blue Cross Blue Shield happened to lose $400 million just in Texas. Carrying on with this article, Blue Cross Blue Shield of Texas is a division of Healthcare Services Corp., which operates in Texas, Illinois, Montana, Oklahoma, and New Mexico. Now, we had Mickey Mann, who's an insurance consultant out of Oklahoma, warn us about this. He was on the show. We interviewed him on the show 3 weeks ago, and he was telling us that the networks are shrinking and plans are being discontinued in Oklahoma. And he quoted this article here. He didn't quote this article, but he quoted Dr. Morrow, the president of Blue Shield, saying, "Hey, we lost $400 million. We can't keep this up. This is unsustainable." So, quote by Dr. Morrow, "It was a very difficult decision, but it was the right decision." Now, I highlighted this in the article because I want you to hear this. MD Anderson, ranked first in cancer care in the nation by U.S. News and World Report, is not covered by a single major insurer on the exchange in Texas. So if you are on an exchange plan in Texas, if you're covered by Obamacare in Texas, MD Anderson is off limits unless you want to pay cash. unless you want to pay out of pocket. Nationally renowned Houston Methodist and Texas Children's Hospital also are mostly shut out of the federal marketplace by major insurer HMO plans. So if you've got children in Houston, Texas, and you want them to be able to go to Houston Methodist and Texas Children's Hospital, like Chalk here or Loma Linda, some of the top children's hospitals in the United States, too bad. If you're on an Obamacare plan, you're shut out. They're not part of your network, even though you're paying exorbitant, overpriced premiums for those plans. Unless you're on a subsidy, then you're getting a nice little subsidy. I'm going back to the article because remember, this is a long article. You can find it. It was December 5th, 2015 in the Houston Chronicle, so you can Google this. But Houston Methodist is in-network in Cigna plans only. So if you have Cigna, you can go to Houston Methodist, but it's in your PPO plan. Patients wanting treatment at Texas Children's must navigate a maze by signing up for Community Health Choices HMO and then selecting Kelsey. So it gives you a whole litany of hoops that you have to jump through so you can go to Texas Children's Hospital. Now, hundreds of doctors affiliated with, and I'm back to the article now, hundreds of doctors affiliated with Houston's marquee hospitals are also now out of network in many 2016 individual HMO plans, not just the PPO plans. Let me read that to you again. Hundreds of doctors affiliated with Houston's marquee hospitals are also now out of network in many 2016 individual HMO plans, hospital officials said. That includes 250 pediatricians who are part of Texas Christian's pediatrics groups. If this doesn't scare the hell out of you, I don't know what would, okay? I don't know what would. You have some of the world's best medicine I'm quoting the article again. You have some of the world's best medicine in the Texas Medical Center where people come from all over the world, much like here in Southern California. Heads of state fly in to be able to go to Cedars-Sinai and UCLA Medical Center, where people come from all over the world. Yet, back to the article, yet here is this segment of the population in Houston, most of them, people who live here can't access it. So here you are, living in Houston. You moved there probably because of access to some of the top medical facilities, the standard of living. You buy health insurance. You go on this Obamacare plan. You're paying higher rates than you were before. You get sick like these folks that we're quoting in the article. You get cancer. You think your health insurance is going to be there to support you. And the next year you're kicked off. And now you can't go see your doctors in your hospitals. That's what we've been warning you guys about for 2.5 years. Nobody wanted to hear it, and now it's coming to pass. And this should scare everybody. Back to the article. You can stand there looking up at the building right in front of you, but you can't get in. And for healthy people, they don't really care right now. But I got to tell you, insurance is the type of thing that you don't know what you don't have until it's too late. We're going to take a break in just a minute or so, but I want to get back to this article after the break and finish this up. There's a couple things I want to talk about this article, but basically expect this to happen all around the country. 2016 is only the second full year of Obamacare. What's going to happen in 3 or 4 years? And if you think the Republicans are going to repeal Obamacare, you're dreaming. You're dreaming because that genie is out of the bottle. Obamacare will evolve, but it will never be completely repealed unless I predict we go to a single-payer universal health care plan, which is what the goal was all along. Joe, we're going to take a quick break. We'll be right back. This is Rick Liuag, Safe Money Talk, KCAA 1050 AM and 106.5 FM. We'll be right back.
Never before has there been a piece of legislation that impacts so many Americans in so many ways as the Affordable Care Act, also known as Obamacare. This ponderous bill is now the law of the land, yet many of us do not yet fully understand how it impacts our health care, our finances, even our retirement. It's hard to get past all the political rhetoric and grandstanding politicians and learn the truth about Obamacare. That's why Rick wants to offer you his free Obamacare Survival Kit. This kit contains information you need right now to protect your business and retirement from the effects of Obamacare. There are no strings attached, and you have everything to gain and nothing to lose by calling Rick's toll-free number right now and reserving your copy. That's 1-800-284-3887. Your survival kit is waiting for you now at 1-800-284-3887. That's 1-800-284-3887.
Welcome back to Safe Money Talk. This is Rick Liuag. Before the break, we were talking about this article in the Houston Chronicle that should scare the heck out of everybody. It's about Blue Cross Blue Shield dropping their PPO plans in Houston, Texas. Now, it may not sound like a big deal to you in California, but I'm going to tell you it is a big deal because it's setting precedents that we had predicted 2.5 years ago that these insurance companies were not going to be able to sustain those plans. Rates were going to dramatically increase, which they have. Even with the rate increases, Blue Cross Blue Shield of Texas experienced a $400 million loss last year. So even with the rate increases, they're now having to cancel plans and shrink networks. What does that mean to you? It means you're going to have fewer choices and fewer doctors and hospitals that you'll have access to. This is just the beginning. Back to the article, okay, because we're about halfway done with it. Quoting the article, at least 2,700 patients at Methodist have been affected by the loss of PPO plans. So there's 370,000 people that are affected by this around Texas and Oklahoma. Diane Duncan is one of them. We're going to talk. This tells Diane Duncan's story. We're being punished, quote, Diane Duncan. We're being punished for picking physicians who are the best at what they do, she said, moving slowly across her Richmond living room, wincing in pain when she thinks no one is looking. Duncan, 64, and her husband, Mark, 66, are self-employed communications consultants. That's key to this article because they were on their own individual plan, not a group plan. They bought their PPO plan in late 2013 prior to Obamacare kicking in on January 1st, 2014, during the first Affordable Care Act open enrollment period. Not because they were sick. So they didn't have any symptoms. They were perfectly healthy in 2013. But in case the worst were to happen, 6 months later, it did. So they were covered. They were happy to be covered. They had a PPO plan. In the summer of 2014, within 2 weeks, he was diagnosed with prostate cancer and she with advanced stage colorectal cancer. Growing up the daughter of a doctor, she had always been told, if you have something serious, you go to the medical center. A flurry of calls led both to highly respected doctors, oncologists, and surgeons. So they sought out the top medical care they could find in the Houston area. Thank God they were covered by their PPO plan. Back to the article. Duncan had his surgery at Memorial Hermann in September 2014 when they were still on the network. His wife had hers 2 months later at Houston Methodist. Both have been cancer-free for a year but need follow-up care. Duncan now qualifies for Medicare, but his wife does not. So Duncan's care is going to be continued through Medicare. However, I'm predicting this for Mr. Duncan. He's going to find in the next couple years that his Medicare network is going to shrink just like his PPO network did. Actually, his PPO network didn't shrink. According to this article, his PPO network just went away. His whole PPO plan went away. Neither Mrs. Duncan's doctors nor her hospital will be in network under the HMO plan their insurer offered them. So this Mrs. Duncan is now going to have to find brand new doctors, brand new hospital, brand new clinic, or pay out of pocket to see the same doctors and hospitals that she was seeing before. I feel deserted, she said last week as she waited for the results of a colonoscopy to make sure her cancer has not returned. What if they find something, she said. Her husband feels something closer to rage. I think the object in all of this is to go back to the way it used to be so insurance companies can pick and choose who they want to cover, he said. That's not true, Mr. Duncan. Now, this is a sidebar. Mr. Duncan, I'm going to tell you what the object of all this is. The object of all this has been from day one, from the framers of Obamacare, which is Barney Frank, Nancy Pelosi, Harry Reid, the insurance companies, and Barack Obama. The goal from day one is to have a single-payer universal health care system run by the government. That's what the goal is. Not for the insurance companies to run everything, for the government to run everything. Okay. Diane Fontaine, Executive Vice President of Administration at MD Anderson, remember, the #1 cancer facility in the United States, according to U.S. News & World Report, has similar concerns about the disappearance of exchange coverage for Houston's prestige medical institutions. Why so fast? Why so complete? Economics, that's why. That's why, Dan, economics. The management of risk used to be handled through, and I'm back to the article, the management of risk, this is Dan Fontaine, the management of risk used to be handled through denials of pre-existing conditions. In other words, insurance companies used to say, sorry, if you got a pre-existing condition, we're not going to insure you. So the insurance companies could manage their risk that way, okay? It's now being handled through the narrowing of the marketplace, which means the shrinking of the networks. This is exactly what we predicted 2.5 years ago. Is some people call it rationing, but what we do is we explain it like this. What's the best way to slow down traffic in Southern California during rush hour? Shrink the amount of lanes or decrease the amount of lanes that are available. So now you've got even a bigger logjam because you've got the same number of cars, if not more, using less lanes. That's what the objective to this, that's what the whole objective to this decreasing in networks is, shrinking the networks, dropping PPO plans. What it's doing now is it's limiting the access that people have to specific doctors and hospitals so they won't use their insurance as much. And if they do use their insurance, the insurance companies don't want these people going to MD Anderson. They don't want them going to the top hospitals, okay? Last year, back to the article. Last year, 19 PPO plans were offered in the Houston region. I'm going to say that again. Last year, 19 PPO plans were offered in the Houston region. When the 2016 Federal Exchange and Private Market opened this past November 1st, just 6 weeks ago, okay, when that exchange opened, there was not one. There was none. So last year, there were 19 PPO plans available for Obamacare plans in the exchange. Starting January 1st, there are 0. Eliminated plans expire December 31st, and enrollees looking for replacement plans have been urged to find one by December 15th to ensure uninterrupted coverage. However, the only choice they have is an HMO, and the doctors and the hospitals that they want to use aren't going to be on it. Cigna offered 7 PPO options on the Houston exchange last year, but now also has none. So if you're in Houston, you're surrounded by some of the best medical facilities in the world, and if you're on an Obamacare plan, you got to pay out of pocket to use them. A spokeswoman said in an email that no one from the company would be available to discuss the reasons. So Cigna got lockjaw. They're not talking. It also would not disclose the number of customers in the area affected by the loss of its PPO plans. Oh my God, this is a nightmare. Morrow, who's the head of Blue Cross Blue Shield of Texas, explained that by law, this is now CEO speak, by law, his company sets rates based on all individual members' claims history or a single risk pool, which is true. If the payouts in one are high, it raises the prices of all plans. Since most people buying on the exchange have chosen lower price over broader choice, that's because the premiums were too damn expensive, Mr. Morrow. Insurers have jettisoned the more expensive plans and presumably expensive providers. Well, that's all good and well. However, what this article is telling us is it doesn't matter how much they want to pay. It doesn't matter how expensive those PPO plans. You're dropping them. They don't even have that choice anymore. So if they wanted to pay $5,000 a month for health insurance, they can't. Back to the article. PPO plans typically cost insurers about 20% more. This is for the insurance company, not to us premium payers. PPO plans typically cost insurers about 20% more than HMO plans because they are less able to control costs in where customers seek treatment, which is very true. A PPO plan, you have more choices, you have more doctors, you don't need a referral, you don't need to go to beg your primary care physician, please let me go see that particular doctor. You don't have to do that, okay? A study by the Robert Wood Johnson Foundation last month found that nationally, 2/3 of insurance companies offering PPO plans for 2015 either reduced the number of plans or dropped them completely in 2016. So the Affordable Care Act was not so affordable. It's already been proven that you can't keep your doctors and you can't keep your hospitals. And now, as predicted by some of us, you now have higher premiums and fewer choices of doctors and hospitals. And it's only going to get worse. Back to the article, Morrow from Blue Cross Blue Shield said his company does offer one HMO plan that allows some out-of-network choice, but conceded it came with a significant out-of-pocket price tag. Did you hear that? It comes with a significant out-of-pocket price tag for you to have health insurance, but to go out of the network. He rejects the idea that his sickest customers are losing life-saving care at premier medical institutions. Of course, but if it was his wife, he might think differently. And I can't really blame this Morrow dude, okay? He's a CEO. He's running a for-profit company, and he was dealt a bad hand. This Obamacare is a bad hand for these insurance companies. I know we all think that the insurance companies were in cahoots, and they were in the beginning. But I think the government pulled a fast one on them. I think the government pulled a fast one on them because I can't imagine it was in their business strategy to lose $400 million in 2014. Okay, back to Mr. Morrow's quotes. This is Houston, Texas. There is very good care in the community, he said, adding that his company would guide any customer in the midst of complex care to an in-network provider. Right, if they're in the network. Okay, not on his life. Okay, now I'm going to drop down in through the article because I do want to tell you tonight what these people could have done, what they should have done, but nobody warned them, and what you could do before this happens to you. I'm going to get to that. I promise tonight. Don't leave. We've still got some time, but I want to go through this article because this is infuriating. It should be scaring you if you're listening tonight. Back to the article. The Houston psychologist, this is Jay Solomon, okay? Let's hear what happened to Jay Solomon. He's a Houston psychologist, sat in a corner chair in the beige treatment room at MD Anderson with his left arm outstretched as a tubed, pumped, it's anti-cancer drug into his vein. I think he's on chemotherapy. He was diagnosed in 2009 with incurable multiple myeloma, a cancer of the plasma cells that produces tumors in the bones. Ouch. In 2012, his condition worsened, and he found treatment at MD Anderson. So he went to the number one cancer facility in the United States, MD Anderson, a decision he believes prolonged his life. He now goes for chemotherapy every 2 weeks as his doctor continues to try new treatments. For 2 years, Mr. Solomon had a bronze Blue Cross and Blue Shield PPO plan. He paid $618 a month in 2015 and quickly reached his $6,000 in-network deductible. That's pretty easy. And $618 a month for a 63-year-old man, that's not bad. He probably got a subsidy because I'm guessing it was probably close to $800 or $900. Now, hear this, back to the article. For Mr. Solomon to stay at MD Anderson and continue with his doctor, he will have to pay out-of-network costs on an HMO plan that could amount to at least $70,000 each year. So he has got a plan that he's paying $618 a month for. He's been going to see the same doctor and getting chemotherapy for 2 years, every 2 weeks. But to continue that now, starting 2016, he's staring at $70,000 a year to continue his chemotherapy. For 2 weeks, he called Blue Cross Blue Shield customer service, trying to find the right person to look at his case and grant him in-network status since he is in the middle of treatment. Last week, he got his answer, denied. He was offered an alternate doctor within the insurer's network. He has appealed. He could very well die before that appeal is heard, okay? His quote to the insurance company is, "You might be offering me care, but you're not offering me comparable care. There's no way I'm not coming here," he said, his defiance tinged with bitterness. So that's fine. He can continue to go there, but he's going to rack up bills because Blue Cross Blue Shield is not going to pay. They're not going to pay him. He can appeal, he can sue, he can do everything he wants, but he will probably die with mounting medical bills in his estate. That's what my prediction is. Countless hours of searching unearthed and little-known option of a small off-network PPO through Memorial Hermann. Customers must use the hospital's facilities and doctors or pay out-of-network rates. $70,000 a year for him to continue chemotherapy. Back to the article. Solomon said he was willing to pay those rates to stay at MD Anderson. He figured between premiums and the $15,000 out-of-pocket cap, he will pay roughly $24,000 a year. So he was paying $618 a month, which is less than $10,000 a year. $600 a month is $7,200, $8,000 a year. Now he's looking at $15,000 plus he's looking at $24,000 a year, between $24,000 and maybe $70,000 a year. Now the $70,000 if he wants to continue to go see his doctors and hospitals, but if he wants to use the hospital's facilities and pay out of network rates, he's still looking at some steep dollars. Back to the article. He realizes, though, that he still could be on the hook for any difference between the allowed amount, right? That's what I just said, okay? For specific treatments and what is billed. That could drive his costs up substantially. And I'm predicting that poor Mr. Solomon, I'm not a doctor, I don't know him. I predict that Mr. Solomon will either have to declare bankruptcy because of catastrophic medical bills, or he will die with his estate owing tens of thousands of dollars in medical bills, and he's been covered by a health insurance plan the whole time. And if you're not angry about this and you're not scared, then I don't know what to say to you. Back to the article, and then we're going to take a quick break. I'm going to finish this up, Joe, okay? In fact, let's go ahead, Joe. Let's take a break now because I need to calm down. And then after we come back from the break, I'm going to tell you what these folks could and should have done and what you can do to protect yourself from this kind of madness. This is Rick Liuag, Safe Money Talk, KCAA 1050 AM. We'll be right back.
Attention seniors on Medicare, if you think Obamacare won't affect you, think again. The more you learn about Obamacare, the more you'll discover that everyone is impacted, especially seniors on Medicare. You must take action now to safeguard your wealth from the unintended consequences of Obamacare. Call our toll-free number at 1-800-284-3895 and we'll rush you a free copy of our popular Obamacare Survival Kit. Call 1-800-284-3895 now and reserve your copy. Again, that's 1-800-284-3895.
Welcome back to Safe Money Talk. This is Rick Liuag. Before the break, we were digging deeper into this article in the Houston Chronicle, dated December the 5th, about Blue Cross Blue Shield of Texas dropping its PPO plans and putting 370,000 people basically not out in the street. They can pick an HMO. However, a lot of those people are losing their doctors and hospitals, and we're telling horror stories about cancer patients losing their doctors and hospitals, chemotherapy patients now looking at $70,000 a year out-of-pocket costs. And it just gets worse and worse. And if you're thinking this isn't going to hit you, it's not going to affect you because you're on Medicare, you're wrong. It's going to hit you because this Obamacare stuff is going to impact every segment of healthcare. Medicare, Medicare Advantage, Obamacare plans. If you're sitting out there and you think this doesn't pertain to me because my employer offers me group health insurance, I'm going to warn you. Within 2 to 5 years, at least 2 to 5 years, your employer isn't going to be able to afford to offer group health insurance anymore, and you're going to be just like these folks, exposed to Obamacare plans and shrinking networks. It's going to continue to get worse and worse and worse and worse. But we're going to talk about something these folks probably could have done, should have done, and something that you can do to protect yourself from this. You're never going to get around this. This Obamacare stuff is here to stay. It's only going to get worse. It was designed to make healthcare affordable and available to everybody and make everyone have access to healthcare. I'll tell you what it's done. It's taken and making the divide between the haves and have-nots even bigger, because this proves right here. This proves to me what we predicted 2.5 years ago, that those with money are not going to be affected by Obamacare because they can dig in their pockets anytime they want and pay for whatever health care they want. Do you think Obamacare phases Donald Trump one single bit? If Mrs. Trump gets breast cancer, do you think he worries about MD Anderson being on his wife's network? He's going to put his wife on that big jumbo 747 private jet, fly her down to MD Anderson and tell the doctors, get to it, I've got deep pockets. So Obamacare has made the divide between the haves and have-nots even bigger than it was before, not made it better and easier. And this proves it, okay? I'm going to finish off this article, and then the rest of the show I'm going to tell you exactly what to do to protect yourself from this kind of nonsense. You're not going to get away from it. If you're on an Obamacare plan, you're on a PPO plan, and the insurance company cancels it, there's nothing you can do about that. But there is something you can do today to protect your money and to get you better access and not go broke. To finish this off, medical discrimination, that's the question in the article. Quote, I thought the ACA, Obamacare, was trying to get rid of some of this kind of discrimination, he said, blaming not the health care law, but the insurers that he thinks have found a way around it. That's BS. This is not the insurance company's fault. They are a for-profit company. They got to make money, okay? $400 million loss. This is the fault of the health care bill and those people that passed it. It was a bad design. Political opponents of what's known popularly as, I'm back at the article, as Obamacare, say this is what they warned about all along. I did. I warned about this starting January 2013. Others accuse hospitals and drug companies of price gouging. So everybody's pointing fingers at everybody else, okay? But let me ask you something. Would you go to work tomorrow for free? Would you go to work tomorrow if your employer had you pay him $100 a day to work there? No, you could not economically do that. Do you think a hospital's any different than you? Do you think a hospital or a doctor or an insurance company, do you think they can continue to do business by losing money? No, they cannot. MD Anderson officials call the anger misplaced. So MD Anderson saying, hey, this isn't our fault. This is Blue Cross Blue Shield's fault. Blue Cross Blue Shield is saying, we cannot sustain this anymore. So now we're going to hear quotes from Jay Schloger. He was the very first person we talked about. He says, I ride my bicycle 6,000 miles a year. I can run circles around 20 and 30-year-olds, but I've got cancer. And he was diagnosed with melanoma in 2003, according to the article. Okay. His wife, Jody, was first diagnosed with breast cancer in 1998. The disease went into remission but came roaring back in 2012. So going down the article, because I'm just about done, when the ACA became law, she was able to get an individual PPO plan and clung to it. This year she paid $916 a month. Her husband paid $941 a month. So they were paying $1,800 a month for a PPO plan that they can't get anymore. These people are desperate and they're upset. They're scared, and very well they should be. And if you're listening tonight or you're hearing the podcast, you should be angry and you should be scared too. But I'll tell you what you can do. I'm going to give you my number, 800-568-3817. You can call me anytime. Just tell the folks that answer the phone there, that's my answering service, that you want the new book that I wrote called You're Going to Need a Bigger Boat. It's You're Going to Need a Bigger Boat, How Obamacare Threatens Your Retirement Savings. We talk about this very subject right here, but I'll tell you what these folks could have done several years ago if they'd have known to do this. And this is what you can do tomorrow. There is a brand new, actually, if you would have told me in 2007 that the very best medical benefit in 2016 was come out of a life insurance policy and not a health insurance policy, I would have said you were crazy. What? Life insurance is for life and for life. You die, you make the death benefit, or you get the death benefit, or your heirs do, your estate does. And health insurance is to keep you alive. It's for health insurance. No. Several years ago, the insurance companies designed a life insurance policy that you didn't have to die to get the death benefit. And let me draw a picture in your mind if you're listening to this. I want you to picture a pool of money, a big bucket of money. That's your death benefit in your life insurance policy. Now, an old traditional life insurance policy, you could buy this policy for a monthly premium, let's say $100 or $200 or $300 or $50, whatever it was, get your death benefit. And when you died, it would replace your income to raise your children, or it would marry your daughters, or whatever you wanted to leave that death benefit to your heirs for, whatever it was for, to continue on with their education, whatever. Guess what you can do with it now? You can buy a life insurance policy today that the death benefit you can access it, that big bucket of money over there, that big pool of money that you used to have to grab into only when you died. You could only grab into it when you dropped dead. Your heirs snatched it up or it went to your estate. Now, any of these folks in this article that I read to you, any folks that are out there listening, if they would have had this life insurance policy, that they could have accessed that $2 or $3 or $400,000 death benefit in a lump sum, and they could have used it to go see any doctor or hospital they wanted to. They wouldn't give a hoot whether that doctor or hospital was in their network. It would be inconvenient. They would have to dip into their own life savings otherwise. But this way, if they had one of these life insurance policies, they could have used an insurance company's money. That's the point I want to make, is because of Obamacare today, and this article is a testament to that. It's happening, guys. It's happening. Networks are shrinking. Insurance companies are dropping plans. More people are going to have to come out of pocket to stay alive. Because of these new plans, access to cash is what's going to keep you alive. That's why I say that Obamacare is the greatest threat to seniors' retirement savings than any volatile stock market or real estate crash. You think that a global financial market crash is the greatest threat to your retirement savings. That's not true. That is it's a threat to your retirement savings, but let me tell you what could happen to these people in this article that I just read. They want to stay alive. They are scared. They want to go see their same doctors and hospitals. Do you think they care about going broke? Do you think they care about burning through their retirement savings or taking a reverse mortgage on their home? This guy that's going to pay $70,000 to continue his chemotherapy, where's he going to get it? He's going to either liquidate his IRA, his 401k, he's going to do a reverse mortgage on his house, he's going to use his cash. And that's what you'll have to do if this happens to you. So what I've done for myself and what I recommend to my clients is this. Get one of these life insurance policies. I don't care if you get it from me, if you get it from somebody else. Get it now. Get it while you're healthy, because here's what it's going to do. It's going to protect not only your life, but it will protect your money if you have any. Because here's what you're able to do. You can take those monthly premiums. If these folks were making monthly premiums on a life insurance policy in lieu of this health insurance policy, they'd probably have been better off. I don't really think that, but they might have been in the long run, especially if they had a big enough death benefit. Because if they would have had a death benefit of $400,000 or $500,000, and she's diagnosed with breast cancer, or he was diagnosed with prostate cancer, he could have accessed a major portion of that death benefit tax-free and spent it on anything he wanted to. MD Anderson, he could have gone to any doctor and hospital that he wanted to, anyone. So this is how you protect yourself from this that's going to happen. This is going to happen in California. It's already happening in Houston. It's already happening in other parts of the country. So here's what you do tomorrow. You go find a health insurance or life insurance agent, or call me, 800-568-3817. We'll work you up a quote on one of these plans, and then here's what you do. You buy one of these life insurance plans that have what's called accelerated death benefits, living benefits, whatever they are. What it simply means, it allows you to access the death benefit in the event that you are diagnosed with a terminal illness, a critical illness, or have a chronic medical event like Alzheimer's disease, cancer, heart attack, kidney failure. Now, granted, if you never ever get sick and this doesn't happen to you, that's fine, good and well, because when you pass and die, that death benefit's going to go to your estate, your heirs, whatever. So you're never going to lose that money. That money, you're always going to get back more than you ever put into it, either in a death benefit or using it for a medical event, okay? That's the only way that I can advise you to protect yourself from this, other than burning through your own money. So you have two choices. If this happens to you and you're a cancer victim and your doctor and hospital is not part of the network anymore because your health insurance company dropped your plan and kicked them off the network, what are you going to do? If you have the money, you're probably going to dip into your savings and try to stay alive, right? Right. So you're going to use somebody's money. It's either going to be your money or it can be an insurance company's money. If it's an insurance company's money, it isn't going to be a health insurance company's money. Now, prior to Obamacare, I couldn't say that. It would probably be a health insurance company's money. But these folks here, there's no health insurance company who's going to pay for this. They're going to have to pay out of pocket. So if you have one of these life insurance policies, what are called accelerated death benefits, you can access that bucket of money and do whatever you want to it. If Cedars-Sinai is not on the network in 5 years on your Obamacare plan or your Medicare plan, and you need to go to Cedars-Sinai here in Los Angeles, if you had $400,000 in your hands, you could go to Cedars-Sinai. You could go to anywhere you wanted to, okay? So that is the way that I recommend that you protect yourself. This was predictable. Those of us that had studied this bill starting in 2012, we saw this coming. We warned everybody. We said this is going to happen. And people said, nah. You're chicken little crying. The sky is falling. You're crying wolf. You know what they're saying now to me? Well, the Republicans are going to repeal it. Really? Tell that to Mrs. Duncan. Okay, tell that she doesn't have any time for the Republicans to get around to repealing it. She needs something done now. These folks, and this could happen to any of us tomorrow. These folks didn't expect it. They thought they were doing right. They thought they were playing by the rules. They bought their plan. They did exactly what they were told to do. They were playing by the rules, and they still got run over by a bus. And this should anger you. It should scare you, but there is an answer. There is a way to protect your access to health care. There is a way to protect your assets. It's simple. You better do it now while you're young, while you're healthy, while you can get this insurance. Now, even if you have life insurance now, you may have a whole life policy or a universal life policy or a term policy. If it doesn't have this accelerated death benefit now, contact us. We'll see if you qualify for these new type of life insurance policies. But I will tell you, this life insurance policy with living benefits is the number one defense against Obamacare and your rug being pulled out from underneath you. This is sad. I'd like everybody that's listening either live or on the podcast to go to Google this. Go find this article, the Houston Chronicle, December 8th. You can Google it and read the article for yourself. It was sent to me early this morning, and I read it, and I said, I had a whole another topic to talk about on the show, but there's nothing that I talk about during the week to folks that I think is more important than this subject right here. And here's why. Because most people don't know any of this. Most people think, well, I've got health insurance. I'm going to be fine. Well, I've got Medicare. I'm going to be fine. That's not true anymore. It used to be true. Next week, we'll probably be talking more about how business owners can protect their business and their families and their employees. To recap this, go to Houston Chronicle, Google it. You can tell I'm shaken up by this, but we predicted this. We saw it happening, but there is some things that you can do to protect yourself. Tell all your friends and your relatives to tune in to Safe Money Talk every Tuesday from 6 to 7 p.m. on KCAA 1050. If you want to watch the video stream and listen to it on your computer or your mobile device, go to kcaaradio.com, or you can go to the podcast anytime during the week and listen to KCAA and listen to Safe Money Radio, Safe Money Talk on kcaaradio.com. We'll see you next week. This is Rick Liuag, Safe Money Talk, signing out until next week. God bless. Take care. Have a great week.